chat with you. Welcome to our weekly Wednesday wellness chat. For those of you who don't know us, I am Dr. Arjun Rayapudi, and this is my lovely wife, Dr. Shobha Rayapudi. We're both co-founders of Gift of Health, lifestyle medicine doctors. At Gift of Health, we help people to prevent, arrest, and reverse disease with food and lifestyle as medicine, so that you can have more fun, more energy, and more health and more joy, so that you could do whatever you want to do with your friends and family at work. And so that's what we do with lifestyle medicine.
To some, lifestyle medicine may not make sense. So basically, like if typically people ask, what do you do? I mean, like I know, like lifestyle medicine sounds like some voodoo stuff, or it's some as if it's some complementary medicine, or it's not the traditional medicine. So I really love the way you explain your patients, like what do you do, like what is lifestyle medicine, and uh, what do you do, like
Yeah,
before
so in lifestyle medicine, we're addressing the cause of the problem. We're treating the roots, right?
before you jump on that, like uh, I would like to share like a recent conversation like we had with one of the patients. So they were like, okay, what do you do, like what is lifestyle medicine? And this is how the conversation went. So we said, okay, do you have a kid? He said, oh yeah, I have a 3-year old. So let's say if that 3-year old had an ear infection and it's running high temperature, so you take your kid to the doctor, and because the kid is having high fever, um, the doctor gives some Tylenol. So here, I mean, the Tylenol, it brings down the fever. And again, next day, we give the Tylenol, and again, the fever comes down, but it comes back. So here, do you see, like the Tylenol or the medicine, it addressing the symptom. Right now, the child is having fever, and that's what we are addressing. But if we don't treat that ear infection, the fever will continue to come back. So, in lifestyle medicine, actually, what we do is we address the root cause of the disease so that, like, people can lead a healthy life rather
Mhm.
than just addressing the symptoms.
Yeah.
Like whatever we see in common medical practice, like pills, procedures, medications, we are not saying they're bad. They are needed, and they are needed to take care of the issue, take care of the symptom. But if we do not address the root cause of the disease, we won't be able to take care of the situation.
Yeah, so they both go complement. Like they what we are doing with medications and surgeries and procedures. They're important, but at the same time, if we don't address the cause of the problem, we're just doing like band-aid approach. Uh,
Like as like you see so many people with cuts or fractures, right? So let's say even whenever we have a cut, and if you see, like our body heals, the cut heals, but let's say if we don't allow the cut to heal, like we keep on banging on it three times a day, so do you think it's going to heal if we don't give the body a chance to heal? Is the same thing. And sometimes we don't realize, uh, 3 times a day, like we bang our body with food or substances that cause inflammation in our body rather than allowing our body to heal.
mhm.
So when we address the diet and lifestyle, like we can take care of the situation. Like mostly 80% of the diseases that we see nowadays is due to the poor diet and lifestyle choices.
So, like today, we wanted to share a very important things about a topic that is very dear to us about heart health. Like February is Heart Health Month. So, in order to honor our heart, which is non-stop, like beating for us to keep us alive 100,000 times a day. So we're going to be uh, sharing our perspective on how best we can take care of our heart, and bust some myths about a heart disease, and how what are the foods that we could use uh, to take care of like if you already have heart disease, food has a huge role to play in not only like preventing or arresting it, but it may even reverse the heart disease. So just
While you're talking on food, I really want to show something on food. What do you think?
I know. Yeah.
You said you
So
wanted to start with that.
yeah, putting sentence stays. Yeah. So yeah, that's the internal discussion. So uh, like we have a uh,
So, I mean, I know like when it comes to heart disease, it might be a big topic. Um, but we are thinking maybe there are 5 things everyone should know about heart disease.
yes, before we get started, we really, we see that many of you are joining from all over the Canada, US, and even different parts of the world. Make sure comment and let us know where you're joining from, and also like and share and invite your friends and family members to join the conversation, and also share like in the comments, like if you have any questions about heart disease, or if you have any questions about using the food or lifestyle as medicine regarding treating chronic disease, feel free to share. But it- so Shu will uh, before we get started, we'll show you a video of one of our favorite chef, um, how, and then we can get started on like why these kind of well, let's not break the suspense, but we'll start with the video. See, we were going to show you how to make healthy recipes, like the how that support your heart health. Then we came across like this video. We thought like this was a great place to start with. So share computer sound as well. So this is an example of like what
Make a
can
beautiful
actually
twist
cause
on
heart disease.
French toast. This could be the most amazing breakfast, brunch, even a dessert if you put a little scoop of ice cream with it. It's a real treat. And I think it's a beautiful thing to do for someone you love. So we're going sweet. I'm putting combos of flavors together that I think work really, really well. Let's start off with the basics. We're gonna get our egg that I can't get out of the box and crack that into a bowl. I'll put 2 eggs in. Lovely free-range eggs. Look at the color of those yolks. So into those eggs, a little thimble of vanilla extract and a tiny pinch of cinnamon. Whisk that up, and that is basically your kind of sweetened, flavored base. And of course, I'm gonna use, just regular bread, but you could use brioche, you could use croissants, panettone. All of these make the most amazing French toast. The great thing about the bread, of course, is it sucks up that beautiful vanilla-y egg. So into here, we'll go in with the bread and just press it down. You can see it all absorbing into it. It becomes part of it. Right into the corners. Then I'm gonna go in with the chocolate. Now look, you can have fun with the chocolate. So my wife absolutely loves chocolate. It's her thing. We're gonna go in with her favorite chocolate, sort of 70% cocoa solid. Just a few little clicks. That'll melt and be beautiful. So let the bread suck it all up. The chocolate's in there. Just press that down. Okay, so whilst that soaks up all the lovely egg, I'm gonna take a little knob of butter and that goes into the pan. And then I wanna kind of bring it together with more exciting things. Banana is one of the things. If we get it in that pan, we can caramelize up this banana to be really delicious. So what I'll do is I'll just cut the banana in half lengthwise like this. So just put the banana on the butter. and we're just going to fry it for a couple of minutes on each side, and it's going to intensify the flavor, and it kind of goes like really toffee-like, really unctuous, really scrumptious, and it's amazing. You're going to love it. And definitely those occasions like Mother's Day, birthdays, you know, Valentine's Day, I do try and get my missus to stay in bed, and I do breakfast in bed. So look, as these fry up, which is lovely, I'm just going to toast some nuts. You can use almonds, you can use peanuts. I love hazelnuts. They're such beautiful nuts. So just toast your hazelnuts until lightly golden. That will make them taste so much better. And then I'll pound them up in a pestle and mortar, and that'll be a beautiful sprinkle. So a little bit of butter in a pan, and then in with the French toast. So I've got this pan on a medium-high heat. So I'm getting a nice bit of colour on those beautiful bananas, and that French toast, we want to go nice and golden. I'm just going to take these little hazelnuts and I'll let them cool down a little bit. So time to turn over the toast. Look at that. And of course we want to get it lightly golden, you know, kind of crunchy on the outside, fluffy on the inside. We want the chocolate to melt so it just oozes. And then I got a little trick that I think you're going to love. Let's turn over the banana. Look at that, sizzling away. So like after about 4 or so minutes, we've got really nice golden colour on the banana. The French toast is looking good. A little cheat that I love, if you've got some icing sugar, just shake a little bit over the French toast. What you can do is create the most incredible crunchy outer crust just by flipping it back onto that side. So in literally 1 minute, you can see the smoke coming off there. You would have caramelized that icing sugar. Have a look at this. And when that cools down a little bit, it'll go crunch. So crispy outside, fluffy inside, oozy chocolate, caramelized banana. Come on, this is gonna be the best breakfast brunch ever. Right, let's plate up. So I like to serve this with a little bit of Greek yogurt, nice little dollop in the middle like that, followed by our lovely banana. That little bit of cooking completely changes the banana. Maybe a little bit of yogurt on the top like that. If you wanted a little pinch of cinnamon, that's cool. If you want to take those beautiful hazelnuts, just pound those up. Some chunky, some fine, but the flavor will be amazing. And I'll sprinkle some of that over the top like that. Then the French toast is done. So let the French toast cool down. Don't be tempted to touch the caramel. It's very, very hot. Right, let's get in there. Let's have a little look. And just look at that, oozing. That is the most extraordinary, indulgent, fantastical start to the day. Right, got to try. Let's go for some of the banana, hazelnut. So good. I'm getting the vanilla as well, which is really, really nice. Crunchy, spongy, oozy. Absolutely delicious. So go on, have a go at that recipe, guys, and enjoy. Take care.
So how was that delicious recipe?
So we see a comment from Erin on our Facebook page. It says, "Hello from Munmed, St. John's, currently Cornerbrook. This video is making my arteries cry." Yeah. So
but like, do you see, like, this is a delicious breakfast, no doubt, and like,
yeah, it tastes so good. It looks so good.
It is so tempting, and
You have chocolate in it. You have sugar in it, right? Like butter in it. It's like on our bread. It's all refined bread, like so. Eggs in it. So it's like full a concentrated load of sugar and fat and chocolate.
and also yogurt. So dairy in it,
Yeah.
yogurt in it. So I know, like, when we have this for breakfast, seldom do we realize like what it is doing to our arteries or what it is doing to our heart. And not only once, we have 3 times a day.
So meals of this sort, like where some sort of animal products like either eggs or dairy products or meats or processed things like sugar, eating oil and butter, eating these kind of foods has culturally, all of this is so common, and
it's normal.
It's normal. And with this kind of eating, The when we eat this kind of foods, it damages these foods increase inflammation and damages the inner lining of the blood vessels, which is called the endothelium, which is very life jacket of the blood vessels. And then with that, you have progression of the starting and then continued eating this way, progression of the heart disease, then plaques form and then plaques rupture, and then we get heart attack. When people get this crushing chest pain and heart attack, and we're seeing more and more lately 30-year-olds and 40-year-olds getting heart attacks, and we're getting surprised, people are getting all of a sudden. But this kind of heart damage of these blood vessels is happening by almost by age 10 with eating like this. So this is one thing that we thought like everyone should know that heart disease heart disease is a dietary disease.
Yeah, so number one thing that we should all be aware of is heart disease is a dietary thing.
Yeah, it's a pure dietary disease. Like, see, heart disease, you could put the main kind of heart disease that we're talking about is the blockages in the heart blood vessels. The blockages in the heart blood vessels are caused by chronic inflammation secondary to the intake of the cholesterol and the saturated fat, which is mostly coming from the animal foods and processed, like refined products. Like, this is how the inside of the artery. So here what we have is a cut section of the blood vessel or the artery. This is how the inside of the artery should look like, a normal healthy artery. But after continued eating of processed foods, you see the yellow plaque forming. And these plaques you could see in kids as early as age by like 10, 12, these small plaques forming. And
Yeah, you can say, I mean, starting it is small.
yeah,
like
you could see here you could see small plaques. And then from small plaques, this is going to a medium plaque. And then with continued progression, this blood vessel is almost blocked. Like here, what you see in the center is this plaque has ruptured and blocked off the blood vessel. And when the blood vessel is blocked, the heart that is beyond the blockage doesn't have blood supply, and then that's when we get this crushing chest pain and shortness of breath. And that's when people are rushed into having like procedures and stents. And it's a very see, the thing is unfortunate thing is about 1 in 3 people who get this heart attack, who get heart attacks, for them, the first symptom is actually death. They don't even have a chance to get treated in the emergency room with like medications or going for stents or bypass surgery, because this 1/3 of the time you have no chance. So this is not something that we take lightly. We feel for all, like every day in and out we see stories
Like,
of like.
yeah, I mean, it's unfortunate that globally this is the number one cause of death. And
Mhm.
if you look at, this is something that can be prevented. It is preventable. And a lot of times we say, oh, it is because it runs in my family, it is hereditary. But like, if you really look at it, like, heart disease is a dietary disease.
Yeah, and the thing is, what we're doing with heart disease most of the time, like when people get heart disease, uh, for heart disease to happen, it's a concoction. Like when you have diabetes, your risk of heart disease goes up by 4 times. When you have high blood pressure, the risk of heart disease goes by 3 times. If you have both, it's 3 times 4, that's 12 times. If you have high cholesterol and obesity and diabetes and high blood pressure, which is like quite a common recipe or combination, your risk of heart disease goes up by 20 times. And the thing is, these conditions, like when people get either diabetes or blood pressure or high cholesterol, most of the time you end up going on medications. And uh, when the address the cause of the problem, cause of the disease is not addressed, then you keep escalating the medications.
So basically, you're saying the number two fact that people should know is the medications, stent, bypass surgery, or other procedures that are being conducted do not address the root cause of heart disease.
Yes, these medications, stents, and surgeries for heart disease, especially for the blockages, they are only treating the symptom or stabilizing the complications, but not addressing the cause of the problem, the root cause of the problem. We're not saying that you don't need stents. We are not saying that you don't need surgeries or medications. There is a role for them in for many people, but you need to know that in most cases, especially when somebody has stable heart disease, stable plaques, you don't need stents or bypass. You let me just share my dad's
Yeah.
journey with this. Like my dad had diabetes, high blood pressure, high cholesterol, which is a recipe for heart disease, as I just shared. um, 5 years ago, he started having shortness of breath, and he happened to have an angiogram, which is special X-rays of the heart, which showed 90% blockages in two out of the three main blood vessels that supply the heart. And one cardiologist said he needs to have stents, and my dad was trying to get out of it, and he went for a second opinion. The second cardiologist said he needs to have a bypass surgery, and that was a very tough time for my family. These stents and bypass surgeries, these are pretty risky procedures. When my dad shared the news of his heart vessels being blocked, I felt as though mine had been broken. I asked him, Dad, instead of having your chest cut open, why don't you open your mouth and put different plant-based foods? And he thought I'm gone crazy. Like, I have two board-certified cardiologists telling me that I need to have either stents or bypass surgery
in the same week.
Yeah, and you're saying no, you don't need that. You just go for changing your diet. I know it was a back and forth tough battle, but he decided to give us some time, and he decided to try it for a few weeks. Within 2 weeks, he was walking longer distances with no shorts of breath. And his blood sugar control was so good that his doctor had to cut his diabetic pills by 50%. And after that, like he got so like because his body was telling him that he was doing the right thing. In 3 months, he came off of diabetic medications, blood pressure medications, and cholesterol medications that he was taking for over 25 years. And in 6 months, he finished the heart treadmill stress test that he could not finish before. His heart got stronger. And this happened actually this March, because coming March, like next month, it will be 6 years. No stents, no bypass surgery. And since then, actually, we helped hundreds of our students through gift of health programs to overcome these diagnoses of high cholesterol, diabetes, high blood pressure, heart disease. In fact, we had a student like in our program. We're calling student because they're in this. We are board certified doctors, but still we consider ourselves as teachers, as guides to students in our online program. So there was one student, he was 53, and he had a date for a bypass surgery picked out on February the 7th. This happened 3 years ago, and he reached out to us on February 4th, 3 days before. He was 53. He had diabetes. He had high cholesterol, and he was having chest pain. And he happened to have a blockages, like 85-90% blockages in two blood vessels of the heart. And then he found out about us, and he reached out, and then we showed him the science, especially which we'll be sharing with you. Dr. Esselstein's studies and Dr. Ornish studies. We'll come to that in a minute. Uh, this student, like he understood the cause of the disease, and he wanted to give it a try, and um, he never looked back. So
and as you can see, like the first option that is provided to anybody is going for surgery or stent placement.
yes, and but let's finish this story of
So yes, that's what's saying. Like in this case, the first option was like surgery.
Like he was told that he needs to have bypass surgery. Yeah.
And if you remember at that time, like he was also very afraid to try anything else.
Yeah.
Like they were like so convinced that okay, bypass surgery is the way to go.
Yes.
And
So there is a role for bypass surgery. There is a role for bypass surgery, especially in one particular type of condition when the left. See, our heart has three main blood vessels. Like one is the left main divides into left anterior descending and the left circumflex artery, and then there's a right coronary artery. So you have like a three main vessels that supply the heart. If the left main, the main one is involved, then you definitely need to go for bypass. But if the other than that, then there is an as long as the disease is stable, like that somebody is not having chest pain right now, there is a role for medical management. When we say medical management, that means maximizing the diet, the lifestyle, and supplement with like medications as well. So uh, this particular student we were sharing about, like uh, he decided to go 100% plant-based, oil-free under our guidance, and his shortness of breath gotten better, his chest pain got better, and he continued to follow up with his cardiologist. And then he put off his surgery, and then he never needed the surgery. It's 3 years now. He came off of his diabetic medications, cholesterol medications, and he's doing so well. Why we are sharing this is because even uh, this something like the fact that the heart disease is a reversible or arrestable. Like some people may not completely able to reverse it, but they can stop the progression by just changing the diet. So let us share like our screen, and we want to share one. So for while before we go into the presentation, like for those of you wondering, like we see some comments as well about the video of Jamie. Hang on, like we'll be showing a healthier version of how to make a tasty French toast that doesn't kill your heart blood vessels. So we want let us cover this some of the science, so that you all understand why it's important to eat more plants and not load your blood vessels and strain your heart with all kinds of inflammatory foods. So let's share some science with you. Okay, this is my dad. Like this was him in March 2015, and as we shared, like within just a few months, he had a huge transformation, just incredible. And we are so blessed to have him with this full health. Uh, what really opened us to this world of plant-based nutrition was the work of Dr. Caldwell Esselstyn. This is a book that we highly recommend for anyone who wants to learn more about heart disease and how to prevent and reverse with eating the foods that love you back. And Dr. Esselstyn showed that um, like by changing your diet you can actually open up clogged blood vessels. Like here there is this is the angiogram of a patient where what you're seeing here on this side is it looks like the dog has been chewing on it. All this white color is the blood supply, which is like quite in a narrowed artery. And after a few months of plant-based eating, you can see more blood flow. This is an improved, healed artery. And this was accomplished without any medications. It's just with a plant-based diet. We're not saying that there's no role for medications, but it's incredible how our body starts to heal when we give the right fuel. This took few months, but this let us share with you, like this change where there is improved blood flow to the heart muscle. You see the red color is the blood flow, and that has improved within few weeks. If you just look at it, it just took like within 3 weeks of plant-based eating, the blood supply to the heart muscle improved so well that not just on the scan, even improved the symptoms as well. You might think, oh, will it take like 3 weeks even to for me to start feeling good? The fact is, it takes within 30 minutes of within 30 minutes of eating the food, our blood quality changes. Um,
So, like, basically, you're saying, like, what we eat affects our blood quality even in 30 minutes. Like, it doesn't have to. And when we eat breakfast or lunch or supper, like, what we see is, like, I know we cannot see the insides of our body, but like our blood changes so fast when we eat. So let's say when we are eating foods rich in vegetables, fruits, whole grains, nuts and seeds, so you can see the quality of the blood. Like, this is a real blood sample, and you can see, like, uh, how thin, like, it's looking so thin, just like vinegar.
Yeah, compare that to this. Like this is a blood sample of someone who had like all kinds of cheese and hamburger and
Yeah, so
eggs and like
for example, for breakfast, let's say they had Western omelette,
yeah.
ham and
So
cheese, and again for lunch, have a turkey sandwich,
mhm.
and for again for supper, have a shaker bacon chicken. So, like, if you can see, like,
The blood sample is like thick like ketchup, and this change in the blood starts to happen within 30 minutes, like 30 minutes of like from the time the food touches your mouth. Within 30 minutes the blood quality is changing,
so
and that change lasts almost up to 6 hours.
Mhm.
Yeah.
So basically, you're saying, let's say if anybody decides to change their diet to include more vegetables, fruits, whole grains, nuts, and seeds, the blood can go from ketchup consistency to vinegar consistency in that meal.
Yeah.
In 30 minutes.
That's why
That-
you might have experienced this.
Yeah.
You might like when you have your Thanksgiving suppers or like holiday dinners or birthday parties. You have this huge Thanksgiving turkey meal, and then what do? Like you want to? Do you feel energetic or do you want to go feel lie down, like the turkey coma? Right? Why do you think it is? It's because all that rich food, that butter, cheese, and meats, and the sugar, it inflames the blood vessels. The blood flow is so sluggish to the muscles and to the brain, and you just want to go lie down from the and recover from the trauma of that meal that you just had.
So basically, like, you covered 4 points. Like, you're saying that, like, heart disease is a dietary disease.
Mhm.
The second thing is stents, bypass, or any procedures on the heart. They do not address the cause of the disease, or they do not address the root cause of the disease. And number three, what we are saying is, like, heart disease is caused by poor diet and lifestyle. I mean, the choices that we are making, what to eat for breakfast, lunch, supper, those are the things that are affecting, that are causing blockages in our heart blood vessels. And number four, what we are saying is changing our diet will start to heal our blood vessels, and it just takes 30 minutes to even
It will like you might think it will take a long
Long
time to start healing, but you will start to heal even within like few minutes. Like so what you eat for breakfast, lunch, and supper every day, it matters for your heart.
Mhm.
Yeah.
Yes. And the next exciting thing is, we may be thinking, I know it's so difficult to give up our favorite foods, and maybe changing our lifestyle is hard.
Yeah, it is hard, right? Changing our lifestyle is hard, but the good news is that the changing our habits are difficult in the beginning, but once you work on them and you work on the habits, and those habits will reap you so the good habits will reap so many benefits. So, and the good
Yeah.
news is that many people are waking up to it. Like we have had hundreds of students in last even like in a short few months where they took charge of their uh, health, and like by simply changing what's on their dinner plates.
And also, like, if you're wondering, okay, we just saw Jamie Oliver's video of that delicious French toast, and we might be thinking, okay, maybe it's hard for me to give up. Give up eggs, give up dairy. I want to enjoy my favorite breakfast. So why don't we see like how we can make the same breakfast where we do not have to compromise the taste, where we do not have to give away our favorites, but still have a heart healthy breakfast. How about like we see how to make that? Like,
Absolutely, yeah. So we'll go downstairs into our kitchen and to create a better version of French toast that can boost our heart rather than damaging our heart blood vessels. Huh?
yeah, we
Yeah.
don't want to kill our loved ones, or we don't want to block their hearts, right?
Yeah.
We do want to offer them like, I mean, that yummy breakfast for sure, but let us see how we can do that without blocking their hearts, without breaking their hearts, like how we can make.
Before
So
we go downstairs,
so
I wanted to share like
you
couple.
can keep sharing. I'll just go downstairs,
Okay,
okay?
yeah.
Yeah.
Let me know when you're ready, and then we'll
Yeah.
connect. Yeah, okay. Good. So while Shobha is connecting from downstairs from the kitchen, um, so couple more things about this and this um, important disease that is taking like so many lives. Um, Let me share my screen. Like let's see. So if you look at the current treatment model that we are using for a heart disease is mostly like using going with like when somebody comes with symptoms, then they get tests, and then they're diagnosed, put on drugs, and then the symptoms don't improve, and they go through more tests and then more medications, and you develop complications from the disease itself, or the complications from the medications, and then more drugs and more like stents or surgery. uh, this is the vicious downward spiral that many people go through when you don't address the cause of the problem. Uh, like when we are going for stents are the metal supports to open up the plaque. That we are not addressing the cause of the problem. We're only opening up the blockage. But if you continue to eat the same foods, do you know of anyone who had stents before and then their like stents got blocked again? It is so common. Even when you had the bypass surgery, the blood vessels, the new blood vessels can get blocked if you keep eating butter, cheese, eggs, and meats and processed foods like sugar, oils. It doesn't have to be that way. Like at the Gift of Health, what we are sharing is basically we are focusing on education, educating about the body, how the body works, and then educating about the food, educating about the mind. And then you also need to not just information, you also need to know how to do it, like how to cook, how to shop, how to read nutrition labels, how to deal with cravings, how to deal with difficult family members. And also you need a supportive environment. Like it's very hard to do like lifestyle changes, like create new habits, if you don't have good environment, supportive environment. And all of this surrounded with a circle of support from us and all the Gift of Health family members. Over like 400 people have completed Gift of Health programs so far. And all of these people are like we created a very close community to support and nurture each other. So with this model, we've been hugely successful helping people to address their disease at the root level, at the cause level, and eradicate it. If not eradicate it, even at least like make sure it doesn't progress or make it better as much as in possible. Some people think like, does food really matter for our heart health? As we just shared, our food starts to affect our blood vessels within few minutes. But just look at this. By age 50, we each one of us end up eating about 100,000 pounds of food. 100,000 pounds of food. Just let that sink in. And this uh, like we are taking at least 3 to 4 pounds of food that damaging the blood vessels, and then taking medications while still eating the foods that damage our arteries and damage our heart. It doesn't help. um, so what about this animal foods, right? Like some people, many of us think that it's okay to eat chicken and eggs, but turkey and beef and processed meats. The thing is, the problem with the animal foods and the refined foods that these are high in fat, high in cholesterol, high in calorie density, high in protein. And high animal protein increases inflammation. They promote heart disease. They increase the risk of diabetes, and they don't have any fiber, no phytochemicals, antioxidants. Whereas the plant-based foods, the whole plant foods, you have lots of fiber, antioxidants, phytochemicals. These are low in fat, low in cholesterol. Um, like they not only arrest the disease, they also reverse the disease. So plant-based foods, they trump animal-based foods when it comes to health and nutrition, well-being. You see, you don't have to just eat. Some people think like plant-based foods means that you have to eat salads and like rabbit food, but it doesn't have to be that way. You can make burgers and pizzas and lasagna, fries, all kinds of foods. And we have recipes for many of these foods, for more than 250 foods on our website, Giftofhealth.org. So uh, I'm going to check in with Shobha if Shobha is ready downstairs. Just 1 second. Okay, she looks like she's ready. So we're going to connect from downstairs. Okay. So let's put Shobha. Shobha, you have to unmute.
Are you able to hear me?
Yeah.
Okay, good. Okay. So, like we saw the yummy recipe of Jamie Oliver. So, but let us see how we can do the same thing without compromising the taste. So, we are going to make French toast. And yes, we are going to add that yummy chocolate, but let us see like how we can do this. So the recipe for this French toast is on our Gift of Health website. So for this French toast recipe, I'm going to take 1 cup of plant-based milk. So this is soy milk. You can use any milk, either almond milk, oat milk, soy milk, the milk of any plant-based. So I'm taking 1 cup, and to that I'm adding 1 medjool date. So make sure you take the seed away and put in 1 medjool date. And to that I'm adding 1 tablespoon of flaxseed powder. And I'm also adding, like, these are rolled oats, like old-fashioned rolled oats. I'm taking 1 tablespoon of rolled oats. And this, I'm going to blend it. So this is going to be our batter for our French toast. So I'm just going to blend this. So here we have our French toast batter. Pan. And to this, I'm adding a pinch of vanilla extract. And I'm just adding a little bit of pumpkin pie spice. Okay. And now, so our batter is ready. So I'm taking whole grain bread. So this is wheat bread. And I'm just dipping the bread. So just making sure that the bread is coated well with the batter. And I'm turning on the stove. And we want to make sure that we keep it in a medium flame so that it doesn't burn. So here we have our batter. So this is completely dipped and I'm just putting it on the stove. And to this, I'm taking some dairy-free chocolate chips and sprinkling chocolate chips. And then I'm just covering it. And to this, can you grab a banana? So I'm taking a banana. As you can see, like for the French toast, I did not add any oil, any butter. So even without adding anything, we can make healthy French toast. And so I'm just slicing the banana into half and we are going to caramelize it. So as I said, we just want to make sure that it is in a medium flame so that it doesn't burn. And the nuts, either we can use almonds or Brazil nut or any nuts of your choice. We can roast them and pound them. So here, why not let's use Brazil nut? But let's say even if you don't have Brazil nut, it's okay. You can use almonds or cashew. So
It smells good already.
yeah. So here, I'm just taking one Brazil nut and I'm going to just pound it. Okay. And So can everybody see
Yeah,
this?
they can see it.
Yeah. Okay. And here also, I'll just let it heat for some more time because I really put in a medium flame so that it doesn't burn. And while this is cooking, why don't we make the yummy ice cream? Why not have French toast with ice cream? I have some frozen banana. So, like for making banana ice cream, we can use the Yonana machine or the Desert Bullet. But let's say even if you don't have that, you can make it in Vitamix or regular blender too. So I'm just going to show you how to make it in the blender instead of Yonana machine. So I already have some cut banana in the freezer. So this one I took it off from the freezer. So let's say when you're freezing banana, make sure you peel it and then put it in the freezer. Okay. Let us see. You can see that it has nicely caramelized. I'll just let it cook for some more time. Okay, and let's plate it. Can you get the square plate, no? And hot cup of plain white. You couldn't touch it.
Square cover.
Yes, square.
Square.
Okay, I'm just turning off the stove. Okay.
You scoop the cookie.
I know this one came a little bit mushy. And then And I have some Brazil nuts here, so we can sprinkle some Brazil nuts. And then, yeah.
Cut that.
Yeah.
Banana, it smells so good, huh? Caramelized banana. You just eat it like this.
And you can see chocolate oozing.
It's good as it is. If you
yes,
want, like,
yeah. Even if we want to eat the plain one,
yeah,
it's just good as it is.
Or if you want to, sometimes what we do is like we actually make syrup, like banana syrup with bananas, blend the bananas with some soy milk, and we could drizzle it on top.
Yeah.
Or like if you're
yeah, so even if you want to drizzle with the banana syrup, so and as you can see, like we have the cold base, and then we have our warm bananas, and on top of
they're
that,
seen
like
from there,
yeah, and on top of that we have our melting chocolate. So as you can see, like we have a combination of a crunchy, soft, and also warm and melty. I think Shakti is coming from the right time, so maybe I think we should ask him to taste. Shakti,
Shakti, French toast is our chocolate French toast.
Can you have a taste and let us know like how it is?
Yeah. Taste it, ma'am.
Come.
No.
Taste it here. Okay. Okay, just so let us know how it is. Okay, this one, yeah. Maybe, did you want to come here and tell them how it is? I know.
How is it, Papa?
Okay, come here. It's okay. Okay, here. Come, let them know how it is.
So we got a thumbs up from a teenager, yeah.
Yeah, so he was like, it is yummy.
Yeah.
But it is yummy. Like if you can.
So you saw that there is no butter, there is no eggs. We made French toast, and there is no this like.
It's so heavenly.
I like to try the banana. Yeah.
I like the warm and the cold and nutty and soft and crunchy flavor.
It's good.
So this is, I know on Valentine's Day, this is the yummy breakfast that you can serve. So as you can see, we don't have to compromise taste, or we don't have to miss anything. The only thing what we are doing is we're just substituting the healthy ingredients. So instead of yogurt or dairy, we are just using plant-based milk. Instead of using butter, you could see that like no need to add any oil or butter to make our French toast or caramelize our bananas. And
it's a good combination of like it's hot and cold as well.
Yes,
yeah,
it's hot. Yeah, it's hot and cold, and the other thing is you can also top it off with some fruits, either berries, strawberry, blackberries, and it makes. I know I can't stop digging at this. It is so yummy.
And the other thing is you can also taste the nuts, like when you pound it, some Brazil nut. So many flavors infused in it. So the thing is this. Most of the time, many of us think that the healthy food doesn't taste good. But that's far from truth. We could make health food that tastes good, that is healthy, and it tastes good. Like we don't have to compromise on taste. And some this is a big misconception for many of our students when they start out, our patients. They say, "Well, healthy food doesn't taste good." Well,
Yes.
yeah.
Yeah.
I mean, this
So
is.
do we want to go upstairs, like, and see like if there are any questions?
Yeah, we can take questions.
Yeah.
Yeah, if you have any questions about this, so we'll connect from
Yes.
upstairs. Yeah.
While he's connecting, I'm going to finish this. It is really so yummy. Try this. I mean, it's really so good. Nice combination. Okay, I'm coming upstairs. Oh my
Oh,
God.
so we've been talking all along, and then we were muted. We just realized that we were mute. So,
Oh, so sorry.
yeah. So we were talking about the aneurysm. Okay.
Yeah, can you repeat that question?
Okay. Yeah. Okay. So the question is, I have a 3.5 centimeter abdominal aneurysm. Will a plant-based diet make any difference to the aneurysm? So aneurysm is a condition where the blood vessel wall is weakened and ballooned. The reason why we some people develop aneurysm is because of the inflammation of the blood vessel wall, and also um, the compromise of the blood supply to the blood vessel wall. When the blood vessel is not getting good blood flow, then the blood vessel weakens, and the blood vessel starts to balloon out. With a plant-based diet, the good news is that you could manage your blood pressure well, like your blood pressure is more controlled, and you have less inflammation in the blood vessel. So with these two mechanisms, plant-based diet will help. Um, if not any, like it's not going to hurt you in any way, to try plant-based eating.
Yeah. And the other thing is when it comes to making a lifestyle change, as you saw, like when we know how to make those changes, when we have the knowledge and when we get the skills, it's easy to change. And at the same time, when we have the support, it's really, and through Gift of Health, that's what we do. So like we like educate,
Mhm.
at the same time we also give the skills. So just like you saw, like how we could make the delicious French toast without using butter, without using dairy, without using eggs. And so we show like
Yeah,
our
any food
food.
that's your favorite foods. Like we could make pizzas and burgers and lasagnas and popcorn and chips, like you name it. All these foods you could create healthy versions of it.
And like even culturally, like we don't have to miss any foods. And I would say the other misconception is like some of us may be thinking, okay, I don't eat meat, uh, like I'm on a vegetarian diet. But like, do you see like even like when we eat processed food, like in India, like most of the people they don't consume meat, but still like India is number one, like when it comes to diabetes, or like it is really a hot hub for heart disease, diabetes. And if you wonder why is that, like there's a lot of processed food that we are eating, the dairy products or the milk products. But as you can see, like we don't have to miss our favorites. Culturally or typically, we have grown eating foods like that. But when we can make the same recipe without using animal products, we don't have to compromise the taste. We can enjoy and still have a heart healthy.
Mhm.
So
So, you're welcome to. We highly encourage you to follow us on our website. Like you could visit our website. There are over 250 over 250 recipes there that are free, and you could certainly change your lifestyle and habits, starting gradually. Do whatever is easy for you, and then the thing is, if you could certainly do this on your own, but if you like our support, you could also look into our 6-week program. We have a 6-week program where we help you step by step. What are the things that you need to know, how to make a change that is sustainable and that you enjoy. Like it's we want to
yeah.
have more, we want to enjoy the food and enjoy the process, so we can make the process easy for you, and you're doing it with the people who are like-minded, on the same mission and vision.
And in 6 weeks, we have seen massive transformation. Like people are amazed to see
Yeah,
like what,
losing like
yeah. And
15
for
to 15 to 25 pounds, reducing medication by 25 to 75%, and even things like not being able to walk,
Mhm.
even from here to parking lot, to walking 5 kilometers a day within just 6 weeks. So we have seen remarkable things, like, because the thing is, once we our body is designed to heal, and once we put the right fuel into our body, it's the healing process. Like we activate all the million chemical reactions that are happening in all our cells, with the right fuel.
I would say, like, even when people come before the 6 week course, they say, I can't give up my cheese. I cannot give up my dairy. I cannot give up my chocolate, or I cannot give up my favorite foods. And they are amazed to see that in that 6 week, they are able to make a lifestyle change, which they thought was very hard. And for some, it may take years to make that same lifestyle change. And but with our help, like with the knowledge, with the skills and support, they they have been able to do this. So this is something that is possible, and there we just wanted to let you know, like. You don't have to suffer from heart disease.
Yeah,
And
heart disease.
a lot of us either know someone who is experiencing heart disease, and unfortunately, like every 36 seconds, somebody is dying of heart disease as we speak right now, and this is a number one killer too, and this can be prevented. So today, like, bottom line, what we want to get out of this talk is this is something that is preventable, and we can do something about it.
And it starts with your breakfast, lunch, and supper.
Yes.
Yeah, every meal, every bite. It's like this. Every bite you take either supports your beat, like the heartbeat, or it making the heartbeat much harder. So it's the beat, it's the bite helping the beat. Or it's your food bite helping the heartbeat. Yeah.
Yeah.
So with
So,
every bite, you can bite the heart.
oh my God. maybe
I
maybe
get
you should stop.
I get fascinated with this rhyming. When I find rhyming with okay, bite and beat, I'll come up with something with this.
Yeah.
Anyway, I'll share with you guys what I come up with.
Yeah, maybe next week you can share. So we wish you a very happy Valentine's that is coming next week, and we wish that you can definitely enjoy the foods. So yeah, you can definitely check out the recipes on Gift of Health and make yummy recipes and make the change now itself.
Okay.
Yeah.
We sign off. We will see you next week.
Have a wonderful night.